Speaker, first I want to thank the committee for a good job and also wanted to thank the Kenya Kwanza government for implementing its manifesto under the bottom-up transformation economic agenda. Honorable Speaker, healthcare in this country has been one of the greatest headaches. That families go bankrupt, families sell all their assets because someone is sick. Honorable Speaker, we have had an animal called NHIF for a long time. We have put in lots of our money in that. Kenyans have put in lots of their money because they trust that this NHIF would help them sort out their medical bills, that they will not have to sell their assets, that their parents, their kids will not be detained in hospitals. But NHIF has let this country down. It is time now we reform the NHIF to ensure that we have universal health care that will take care of the people that require this facility. Honorable Speaker, you and I will have a medical scheme, and many other organizations and people who work in these big organizations will have medical schemes that will take care of them. But the majority of Kenyans do not qualify under that category, that they will be able to have an insurance for their medical needs. But majority of them look at government and say, what is it that government can do for my health? This government of Kenya Kwanza has said, yes, we have something that we can do for you. We can reform NHIF, ensure it is more efficient, ensure it takes care of diseases like cancer, diseases that are chronic, diseases that at the end of the day when somebody gets this disease, a family goes bankrupt. And we have said we have an opportunity now to reform NHIF and ensure that we have an organization. The Social Health Insurance Bill 2023 is the panacea, the thing that will sort out this issue of medical bills. Honorable Speaker, I take cognizance of some of the most interesting things that are coming out. One, as we pass the digital health bill, it is linked to this social health insurance bill. That apart from the fact that we will treat patients, patients are able to import and export data to other facilities such that those facilities have an opportunity to treat our patients without having them to travel. That we shall have an opportunity to use the much talked about telemedicine that many people say, you know, you can use telemedicine in this country and treat people. But it has not happened because we do not have the requisite law. Now we are putting the requisite law to ensure that telemedicine becomes a reality, that sharing of information becomes a reality. But Honorable Speaker, it is also important to note that health insurance coverage in this country is very low. At least you know that when it is low, then its effectiveness and efficiency is in doubt. But with this new scheme that we will roll, that this government will roll when we pass this bill, we will ensure that we have more and more people that can join. And when you have an organization that is efficient and effective, Kenyans will have confidence such that when they are asked to pay money for a service, they will actually pay. When they will be told that there will be a tax on this matter, they will pay. The problem that we have, Honorable Speaker, is accountability on tax. What I believe in, a justice system, a tax system that is just, is a tax system that is accountable. That when you receive the money, you are accountable to the citizens for ensuring that you provide services. As we reform NHIF, Honorable Speaker, it is also important to speak to the county governments who actually are the providers of this service. What are they doing to ensure that we have well-stocked hospitals? What are they doing to ensure there are doctors who will ensure that we have an accountable system? NHIF pays for what is provided, what the patient requires. Honorable Speaker, the principal object of this bill is to put in place a legislative framework to regulate the provision of social health insurance, promote an implementation of the universal health coverage, and ensure that all Kenyans have access to affordable and comprehensive quality health services. Quality health services is one of the objects of this bill. As we do all these things, Honorable Speaker, one of the most important things is to end corruption in hospitals so that our citizens can get quality health services. That when money goes into this organization, we know, and it led to the dismissal of the MD there who has been there, that corruption has beriddled NHIF for many years. How do we ensure we reform it We cannot just pass a law here and say we have reformed the NHIF. We need to go into that organization, dismantle what it is, and reassemble, and assemble a new organization, an organization that will take care of the of the health care for Kenyans. Honorable Speaker, I take cognizance that, and I want to inform the House that there's been a lot of lobbying from workers in HIF, that they have a problem with Section 2, the last sections, where the transition provisions on workers. They have even lobbied me and said, we want to be automatically absorbed. But this brings into question, how do you reform an organization when you're going to just take everything, put everything that was in the other side, change the name and say you have reformed? Human resource that have been in HIF need to rethink, have they been providing quality services for Kenyans? Have they been truthful to the call to ensure that Kenyans have a universal health system care that really works? And I think this is the time when we need to separate the chaff from the maize and say those that have been bad eggs within NHIF cannot join the new organization. That I support. But what I want also to see is fairness in ensuring that Kenyans that have done well are continue to do well. Those that have not done very well, Honorable Speaker, should pave way for others so that we have an organization that will ensure universal health care. Honorable Speaker, two things matter to me. One, if we can provide good health, good education for our children, the second thing that we must provide as a country is good health care. A healthy nation is a wealthy nation, and we are able to ensure that this country moves forward. Other developed countries, Honorable Speaker, if you go to the United States, healthcare becomes one of the key agendas during an election, healthcare. And every president will give his own idea of how to ensure that he has provided good healthcare for the Kenya Kwanza. Use the plank of good healthcare system to ensure that we win the vote. My friends, the people that Honorable Junet described as a certain animal some time ago, never gave really a good and a credible proposal on healthcare. Kenya Kwanza did. This is the time that we need to ensure we implement what we campaigned on. And one of them is this one. And this we will do within our time. And also to add on what the leader said, not just our time, but this session of Parliament, we must bring these refreshing ideas, this revolutionary idea in the healthcare system of this country. I thank you, Honorable Speaker.
Thank you. And honorable members, I know we haven't asked for reduction of time on this debate, but I'm just asking you humbly that because there's a lot of interest, if we can speak briefly, each of us, if you agree, so that other members can be able to participate. The Honorable Junet Mohammed.